Today, we're joined by trauma specialists who will share expert insights and guidance on recognizing, responding to, and recovering from trauma. Welcome to the show, Dr. Steve Feris.
Good morning. Thanks for having me. It's a pleasure to be here.
It's great to have you on the Pulse Show. I've worked in an acute facility for many years, close to 15 years back then, and I've had the privilege of witnessing firsthand the tireless efforts of emergency teams, the rush of adrenaline as the helicopter lands, the precision and focus of the team as they spring into action. It's truly inspiring. And World Trauma Week, we should be reminded of the importance of self-reflection. As a healthcare profession, I've come to realize that it's not just about the medical expertise, but also about the emotional toll the trauma can take on both patients and caregivers. And that's what we're going to unpack here today. It's also a sobering reminder to prioritize our own well being, supporting each other, and acknowledging the incredible work that our first responders do. So today we are honored to have Dr. Feris with us, a distinguished specialist emergency physician and consultant in critical care. Dr. Feris has extensive experience in rural medicine, emergency care systems, and toxicology. Dr. Feris has held various leadership roles, including Director of the Emergency Department at Netcare St. Anne's Hospital and Lecturer of the University of KwaZulu-Natal. He's a PhD candidate in emergency medicine and passionate about clinical efficiency, systems improvement, and academic mentorship. Doctor, it's really nice to have you with us, so let's dive straight in. Can you tell our listeners what motivated you to specialize in trauma care?
Yeah, so I'm an emergency medicine specialist, and that often comes with fast-paced adrenaline rush, as you mentioned. And that's what drew me to the specialty initially. If you think about shows like ER or Chicago Med, those exciting patients come in, you shock them, you save their life. And that's what initially got me interested as a youngster about 15 years ago.
Yes.
But what's kept me there is the perspective it gives you working in the emergency department, because you're at the crux where society and the healthcare system meet. I mean, most emergency departments are essentially on the street. All that separates us from the outside world is a little glass door
Yes.
that automatically opens as soon as someone needs help. So often society spills over into the emergency department, and right in the ED, you can see the interplay of public health, community, and the various silos of specialty healthcare. And what really makes it such a privileged place to work in, what's kept me going, is you see when the person becomes a patient. So you take them out of their own car, you see their family, you see, what they're wearing, and you take them from their home environment into the emergency department, and then you transition them into a patient. And that raw human experience, this is probably the worst day of their life that you're meeting them on. And to me, that human touch and that human aspect of the emergency department is really what's kept me going there for so long.
Of course. And can you share with the listeners the types of cases you see at your facilities?
So we're a level 1 trauma center. So our focus is mainly on the sickest of the sick. So you'll often see a helicopter flying overhead in Maritzburg, or something on the news that says that Netcare helicopters landed on the N3 and is bringing patients to a facility, and that facility is us. Although that's our focus, we see everything from newborns all the way to the elderly who fell out of their bed and fractured their hip. And it's anything from burns to car accidents to sports injuries to snake bites and stings to large industrial factory explosions or factory injuries. So although we focus on the major severely injured patient, we really do cater for the needs of all. Anything from severe life-threatening injuries all the way down to minor injuries and simple lacerations, or even sports injuries and concussions and sprains. We're equipped to take care of everyone.
Of course. And, obviously the day in your calendar is not like a textbook. It actually adjusts. You don't know what to expect, and your team has to be cognitively ready to deal with everything. In terms of stats, can you share with our listeners anything surprising that might change our audience perspective?
So South Africa is unique in that we face what's called a quadruple burden of disease. So there's maternal and child disease, there's the non-communicable disease like hypertension and
Hmm.
diabetes, and then the infectious disease HIV, TB. But in South Africa, we have the fourth aspect, which is trauma, which is the most common cause of death of anyone under the age of 45 in this country. And that's a big problem. It's a public health crisis in this country. If you look at the statistics of how much interpersonal violence and road traffic accidents actually produce in our country, the death and the morbidity, it's comparable to active war zones. So violence in, say, Edendale or Plessis-Lar or our N3 road traffic accidents, the amount of casualties we see there are comparable statistically to what we see in active war zones today.
Hmm.
So it might be our day-to-day life, but we mustn't become numb to it. The stats are alarming, and people, the Dutch military actually sends people here to train for war zone, even though it's our day to day. To them,
Yes.
these are mass casualties. And what where we come in, what's so important is that those first 60 minutes after an injury are where your most time critical interventions can make the biggest difference. So statistically, if you reach a trauma center or some some competent level of care within 60 minutes, your chances of survival are doubled. And if you go outside those 60 minutes, you still exponentially your rate of complication and demise actually become worse. So getting care fast and efficiently is important. Does save
I
lives.
fully agree with you, Doc. When the public sees that ambo that's actually racing to save a life, make way for them. I mean, it's serious. Time of getting a patient to an ED door is obviously imperative in saving a life. And obviously, we're speaking about the busy, the high pace. Doc, how do you cope with the emotional demands of working with your patients?
Look, so trauma and emergency is, it's emotionally demanding. It's morally exhausting for all frontline workers, from police to firefighters to paramedics to everyone who sees, you know, human condition on a daily basis. And it's very easy to become burnt out or to become despondent. And the common response is, to harden your heart and to sort of shut yourself off to the psychosocial and emotional
Hmm.
aspects of it, and just get on with it. But to me, that actually drops your level of care. And how I deal with it is, you actually let that emotion happen.
Hmm.
You feel what you need to feel. If you see an injured child or a family that's just been devastated by a car accident, you have to take that on. You actually have to process that emotion, because it's going to
Hmm.
help you see the patient as a human being and
Hmm.
see them in context of their family and the community. And that motivates you to do so much better
Hmm.
when you see the person for who they are in their family, in their community. And by processing all of those emotions at the time and using it to provide better care, you actually shut off the risks of burnout and PTSD and dealing with the stress as it comes. Because the more you bottle it up, the more it's going to come back later in tenfold. So how I recommend dealing with, how I deal with it, is you actually just don't shut off the emotions. Let it happen, learn how to control it, learn how to use it to become a better clinician.
Absolutely. And you've got to have resilience if you're a healthcare profession, because obviously you're dealing with different types of trauma coming in. And in terms of recognizing trauma, Doc, how can we identify signs of trauma in ourselves and others?
So in terms of physical trauma, I think the risks is, let's say you're in a car accident or your family member's been injured on a sports field. The risk in that immediate moment is the adrenaline rush. So if you're driving along and you get into an accident, you're going to be so amped up on adrenaline that you won't realize how injured you actually are, and you won't see subtle signs of injury and confusion and injury and danger in your family members. So the things that I would, let's say, if you're in an accident or if you come across a mass casualty, the subtle signs to look for would be things like confusion, change in skin color, either slightly pale or slightly blue, difficulty breathing. You just can't catch your breath nicely. That might indicate that you've got some sort of chest injury. And every nagging little injury or spot, or if you can't walk properly, at the time of impact, or at the time of trauma, it might seem very minor, and that's because your body's defense mechanisms are at 100%. Your pain threshold is high. You have access to superhuman strength during this
Hmm.
adrenaline rush. But don't ignore that, because once that subsides, then you start seeing the complications, and then the true effects of what's happened to you start coming out. The pain is worse. Suddenly you realize your leg's actually broken and you've been walking on it,
Mm.
or you've got internal bleeding and you're suddenly feeling faint and confused. And that's what I, that's that those are the subtle signs that often get missed, is during that acute period when the adrenaline's high and patients can compensate for the injury, is when things go missing.
Yeah, I must salute some of your first responders. I mean, the emergency services, because when they respond to a scene, the caliber of their connection with that patient is what calms that patient and keeps them going until they get or arrive to an ED department. And Doc, in terms of um, trauma, in what is the best ways to support someone who's experienced a trauma?
I think it depends on where they are from the time of injury to resuscitation and then rehabilitation in the ICU. But the main thing is just to be present.
Mhm.
I mean, you don't have to be an expert. You don't have to know how to do anything fancy, but just to be present, and that give them that human connection. Because it is quite a dehumanizing process. You get put into
Mm.
a gown, you get drips and monitors and procedures, surgical procedures done to you, and a lot of it can feel quite artificial. That you as a person feel dehumanized,
Mm.
and it's so important to provide that early psychological support. So we've got a team that includes psychologists, occupational therapists, physiotherapists. That, let's say you've got a hand injury, that occupational therapist is already there working with you, showing you how to open a tap, how to write, how to type, just to keep that quality of life and to get you back to who you were before the trauma. And then the psychologist will walk through from the beginning to the end. I mean, they get the same alerts we get when the patient comes in, so the whole team knows someone's coming. We need to look after them from start to finish through the rehabilitation phase. Healing is both physical and emotional and spiritual. And what's important in trauma care is not just the blood and the guts and the fancy,
Mm.
exciting stuff. It's all these other things that
Mm.
really make a lasting difference when you see your patient for a follow up.
Yeah.
And those are things they remember.
I think the beauty is the multidisciplinary team coming together, and every case will differ. For example, obviously, at the facility that I work, we actually received a family member. There were two gentlemen that actually sustained dog bites, and it was quite serious. They had to go for surgery, etc. But obviously, now they're in my rehabilitation setting, and going to visit them daily. It's obviously the impact, the trauma. They're still healing from that, and it does take time. So that's where the team has continuation of care. And trauma, as you said, it depends on the type of cases and how each person or individual deals with it. Before we take our break, I just want to ask you one more question, Doc. In terms of trauma informed care, how can healthcare providers, educators, and communities create safe and supportive environments for those affected by trauma?
I think the biggest thing with trauma and community is injury prevention. So prevention is always better than cure, and that goes for trauma as well. So things like buckling up or wearing a helmet when you're riding a bike, or just if you're doing sport, teaching coaches how to take care of spines in rugby matches, or drowning first aid in swimming or water polo. And those communities, those educators, those little safety steps we put in place, speed limits, resting, those can go a long way to preventing catastrophic trauma down the line. So in terms of trauma informed systems, I think the big focus and the big role that communities can play is injury prevention, and taking those preventative steps so that you don't become a trauma patient.
I fully agree with you. I think from a young age, parents need to actually invest in the kids to understand basic CPR. I mean, it's World Stroke Month as well, and I think fast is very important of getting that grandparent to an ED and ensure that we can actually look at those signs and symptoms and get things right. So, doctor, how do different types of trauma, example, physical, emotional, psychological, what impact the individuals?
So trauma, as I said, trauma is a multifactorial injury, and it affects your physical self, your emotional self, and then also those around you, the family, the community. Often someone is a leader or a parent or a sibling. Um, and our focus is not just on healing that physical ailment. It's about supporting the family. It's about supporting the patient's physical needs, getting them back to being a full a full person and being their full selves again after their injury and restoring them back to that. And that process with us, it starts right in the emergency department. So we resuscitate you. We get in lines and tubes and surgeries and procedures. But at the same time, we've got counselors and psychologists on our team who are also there talking to the family, explaining to them what's going on, what's happening to your sister or your brother or your mom. So you understand the things we're doing to them in context as they're happening. And that support goes a long way later to prevent things like PTSD or depression, and to get the family and the whole family and the patient on board when we try and rehabilitate you and we try and get you up and running again. Yeah,
So obviously building resilience and giving the family support and
yeah,
empathy and hand holding through the process.
yeah.
That's beautiful, doctor. In terms of trauma informed care, can you tell us why is it so essential in healthcare?
So trauma trauma is a big part of our lives, especially in South Africa. It's so common that you have to have systems in place before the trauma happens, and you've got to all your systems have to line up to look after that sick patient, because that first hour, those first 60 minutes are so critical that you have to get everything absolutely spot on. So we've got systems in place where if someone is injured on the road, immediately our paramedics let us know. They hit one button on an alarm group, an alarm, the physical alarm actually goes off in our department, and immediately everyone in the trauma team is made aware. The nurses, the surgeons, the physios, the paramedics, the psychologists, the blood bank. Everyone knows someone is coming. We need to get everything ready to provide the best care we can within the fastest time we can to make sure that the outcome is good. And those are built into every level, from our engagement with the community to our pre-hospital and our paramedic care to what happens in the ED and all the way through to rehabilitation.
Communication obviously is very imperative. And so
Yeah.
basically, the paramedics are giving you kind of like a virtual picture of what to expect in your ED.
Yeah, so the communities, and especially injuries far out in say farmlands or forestry areas, those communities actually have a WhatsApp group and a communication group with paramedics, so they can just drop a live location and immediately the system starts. So from the first aider, say at the factory, they push a button, the paramedic helps them, we get to hear what's going on, we get a team activated, and it's gotten to the point where we can actually live video call the patient on scene, so through the paramedic or through the first, whoever the first responder is, and we can see what's going on, and we
Yes.
can give advice in real time. That's the benefit of technology these days, is that
Wow.
we can actually provide care before the patient even gets here
Yes.
and give advice.
Can you elaborate about the obviously the differentiation between the different levels of trauma? You guys are level one at the moment at your facility, and obviously you deal with the helicopter and all the emergency systems at length. If you can please highlight how that function benefits the patient.
So yeah, the level, the trauma society of South Africa and internationally, the trauma systems are divided into tiers: level 1, 2, and 3. And we're the only private level 1 center in KZN. The only other level 1 center is in Kosi Albert Lutuli Hospital in Durban. That's in KZN. And what we've got in place, or the sort of standards, there's very strict criteria you have to meet. There are, it's obviously staffing, so you need to have all specialists on board, from brains to spines to heart to trauma surgeons, emergency specialists, and then as you mentioned, the helicopter and your pre-hospital system has to be quite rigid. And then along with that comes a lot of academic requirements. So you have to be academia, you have to produce research, you have to do teaching, outreach, and having that stamp of level 1, comes with a lot of responsibility, because there's this expectation of excellence and there's a standard that you need to maintain. And I must say, we're really blessed in Pietermaritzburg to have this and to have these people and these experts in our town, because it's a lot of work, it's a lot of effort, and it really does make such a big difference to have a system that is well oiled and that works and that's got leading experts involved in it.
I fully agree with you. When I get visitors out of the country, we take for granted our medical specialists that we have in our city of choice. I mean, I think they have vast experience, from our cardiologists to our neurologists and our surgeons. I just want to thank them for the work that they do and those tireless efforts of giving the gift of life. In terms of the impact on individuals and communities, how does trauma affect them?
So I think it depends on your communities. I mean, if you look at, let's take Pietermaritzburg as an example. Everyone knows about the N3. It's
Hmm.
notorious for constant accidents and provides a constant flow of trauma. As a community, the response has to be, as I said earlier, prevention. You know, we can build our trauma system. We can save lives. We can do what we need to do, but the best way to save a life is to prevent. And what trauma should do to a community, and what I hope is, as a level one center, through our outreach and through our education systems, is to get, the injury prevention, the safe stops in place, get the safe buckle up safety, the drowning safeties, all of that in place, and also from the second step. So there's prevention, and then there's the primary intervention. So within communities, we try and identify community leaders, so educators or basic first aiders, or even pastors or priests or community leaders, and use them as contact points to say, here's our number. If you need assistance, please dial us. We'll support you, and then also provide training. So we often do outreach. We provide CPR training,
Hmm.
stop hemorrhage control, all sort of basic spine immobilization. And by building and upskilling the members in the community, we know that when that injury happens, even if it's far away from us, there is someone there that knows what to do, that we've trained, that can keep someone alive until we can get them to a best level
Hmm.
of care.
Doc, we've got a national highway that's cutting through our province and we're getting closer to the holiday season. And I know you spoke about buckle up just now. If you'd like to elaborate and provide our listeners with some tips on travel and what they can do to actually maintain road safety.
Yeah, holiday season's coming up. Roads are gonna be busy. I think the N3 sees massive volumes during the festive season. And the big thing is fatigue. Often you try and do that stretch from Joburg to Durban without any rest. You want to get to your holiday destination. You want to
Mm.
beat the traffic, get through the toll gates. But the more you carry on, the more fatigued you're going to be. And that's when mistakes creep in. So
Mm.
you might not be someone who speeds or overtakes. And then as you get tired, the decision making and your risk taking gets affected. So please stop, rest. There's some lovely stops along the way. Stop, rest, take in the country, take in the scenery, and then obviously buckle up and don't drink and drive. I think the big thing, though, that the common thing is, most people buckle up. Most people know not to drink and drive. It's the fatigue, it's the rest. So every hour, every 2 hours, take a stop, stretch your legs, and that little refresh, the little mental reset can go a long way in helping you remain conscious and vigilant on the road.
Doc, what are some of the common misconceptions about trauma and trauma care?
I think the common misconceptions is that it can be solved by one person, and the big message is trauma is a team sport.
Hmm.
You as an individual, be it a paramedic, a surgeon, an emergency medicine specialist, you cannot solve the problem yourself.
Hmm.
It's a big misconception, especially amongst healthcare professionals, that okay, the surgeons walked in, everything's going to be fine. Okay, the anesthetist here, everything's going to be fine. It's a team sport, and as I keep saying, systems and getting everyone from the community to the paramedic, to the nurses, to the radiographers, to the psychologists and the rehab team, getting them all to work together. I think that's the key, and that's what we've managed to do successfully, and that's what really sets things apart. Um, is the system and the team sport, the
Yeah.
team nature of it all.
And look, it's not a competition. It's obviously getting the patient to the nearest ED center
Yes.
to ensure that they actually get there on time in order to save their life. And speaking to our healthcare professionals, obviously our paramedics, etc., what would be your advice to them in delivering the best trauma-informed care?
It's best for the providers, pre-hospital providers. I think in South Africa we're blessed that they're all very highly skilled and highly trained.
Mm.
We have some great pre-hospital services, particularly in Pietermaritzburg, and I think they all know the sort of ABC approach quite well. Airway, breathing, circulation, and just getting the patient to the best level of care. But the nuances of knowing when to stay at the accident scene or at the trauma scene, and stay and play and try and solve the problem there, and when to get to your nearest hospital to get more assistance. And that little decision making and that little gap there is probably the one place where I would advise, if you're unsure, call for help. We're available to advise. no one's going to be upset to get a phone call to assist their life.
Absolutely. And what's the role of emergency preparedness in mitigating trauma?
So trauma can be chaotic.
Mm,
Someone arrives and there's 50 family members that are all quite distressed. There's a patient that's might be catastrophically injured, and it all becomes very overwhelming and distracting. And being prepared for these chaotic scenarios is what makes it successful. So the best time to make plans is when there's nothing to plan for. So when the patient's not there, when the chaos is not there, when there isn't trauma, sit down with your role players, sit down with your team, write that policy that you've been waiting to write, and get everyone on board so that when it happens, you push a button and everything works smoothly.
absolutely. Trauma is obviously unplanned. It just happens. And for our community out there, our listeners that's listening to us, what advice you give them in order to build resilience if there is a crisis?
So yeah, to the community out there, if there's a crisis, I think it sounds cliche and it seems impossible, but the first thing is stay calm.
Mm,
You know, one thing I mean, I've been in a few crises myself, and you forget the ambulance number, you forget the address of where you are when someone says, "Okay, I'm going to send help. Where are you?" And those sort of basic things, I think, if you can say them on your phone, if you can write them next to your landline, and then you've got your ambulance number, you've got your address, so that
mm,
help can get to you. I think that's the biggest takeaway is to have, just like we have emergency preparedness and systems in place in the hospital, at your workplace, at your school, at your home, you know, show your
mm.
kids where the panic button is, where the alarm button is to get the ambulance here, and just having those little steps in place before something happens is going to save a life.
So, Doctor, breaking the stigma is very important. It's also World Mental Health, and you're dealing with the patient, you're dealing with the families. And I'd like you to elaborate in terms of the journey of the patient. Why is it important that they need to talk about the experience? Why is it important that healthcare professional need to talk about the incident, like a debriefing, so that you can move on?
Yeah, no, I can actually tell you quite a few stories. When we see first line responders, so police officers, firemen, prison guards, who get injured while in the line of duty, say by fire or gunshot or assault. You see them and you treat them, and then during their follow-ups, I'll just share a few stories. We notice, this gentleman doesn't want to go back to work, and you can't put your
Mm,
finger, your injuries are healed, your surgical sites are clean, you struggle to see why you can't get this man back to
mm,
the person they once were. And that's when well, that's when I first realized, what a big psychological and emotional role there is for in trauma care. Someone who was shot in the line of duty, for example, say a police officer or security guard. It takes a lot to get them back out there
mm.
to put themselves at risk again, and to get them back to the brave person they once were. And that's so key, that we need to address those things as they happen. So I mean, I sound like a broken record, but again, the multidisciplinary team approach, getting your psychologists and your counselors on board, and then even you as a doctor being empathetic and actually taking time to listen and to hear what your patient's going through. That can go a long way to prevent post-traumatic stress, or prolonged acute stress disorders, where someone doesn't want to go back and they actually change who they are. Because the goal of trauma care, once we stabilize you, we want to get you back out there to the person you were, to the parent, the father, the sibling that you were
Mm.
before the trauma.
And in terms of the advancements in trauma, I'm sure you keep yourself up to date. Can you update our listeners on, in terms of like stroke and heart attacks, has there been any advancements on response time and how to do things differently?
So the field is constantly evolving. Everything is always cutting
Mm,
edge. Every week you open a journal, something new has come up. Um, from for stroke and for heart attacks, we focus on getting this early recognition. So getting the patient to the hospital within 60 minutes, getting your scans and your ECGs done within 10
mm,
minutes, and then providing intervention. And in terms of trauma, there's been things like automated CPR machines. We have more advanced ventilators to the point where you can ventilate and do CPR without actually touching the patient. And we have those technologies available. But when you look at the cutting edge research, they're also quite expensive. And in Africa and in South African context, what's been the hot topic in innovation is what's called frugal innovation. So just making small little differences, cost effective differences with what we have. And that's, if you look at the local leading trauma experts, the professors and the PhD guys in KZN, that what they're researching and what innovations they've come up with, it all points back to systems. And to having systems in place, and even across Africa. I mean, I do quite a bit of work with the African Emergency Medicine Society, and across the continent, a lot of what we're doing, as a continent, we're still in the developing phase of getting our systems in place, getting our our radio telecommunications up and running, before we can even think about all these expensive machines and the latest drugs. What we need to focus on in an African context is really getting the systems and getting the community involvement, as we spoke about. That's really what the local, where we are locally, is innovation needs to happen in communication and systems.
And accessibility, of course.
Yes. Yeah.
And in terms of the measurement and effectiveness of trauma-informed care, how do you guys measure your stats?
So, they say you'll know a tree by its fruit, and if it bears good fruit, then you know that it's a good tree, and that's what we do. We have weekly reviews. I mean, not monthly reviews, where we look at our statistics, our deaths, our mortalities, our morbidities, and we present the cases where things go wrong. And you have a panel of experts. Even we invite external reviewers to come and have a look at where did things go wrong, what have we done. And then another big part is maintaining a database. So we've got we're blessed with having electronic records where we have a large database of all the patients we've seen. So you can always go back and measure, how fast did we do this? What did we give? What worked in this case? What didn't work in that case? And we can have these hard conversations of how to make things better. Because at the end of the day, that's what we want to do. We can measure how many people we saw and what's worked, and then we can implement what's worked into our next protocol update to make sure that the next patient gets better care and doesn't suffer.
We've got different category of listeners listening to us this morning. We've got educators and, of course, variety of medical professionals. How can we as a community sustain trauma-informed care initiatives over time?
I think it's identifying leaders within the community and the healthcare system, and equipping and educating them on what's needed. So the injury prevention program, the communication programs, the activation between hospital and paramedics, and once we identify that leader, just make sure that we have a sustainable mentorship and leadership development system to ensure that our key role players are all involved, and that when they move on to something else, we've got the next person lined up that we can work with. Because through those people, through principals and community leaders, we can then affect that community, that school, that workplace.
Absolutely. As part of your life skills programs in school, I encourage the educators and as well as the factories to invite the medical professionals to your facilities. Choking, CPR, injury prevention is real. So the more advancements, the more education, we can streamline the process and make it much easier. As we wrap up today's discussion on World Trauma Week, we want to thank our guest, Dr. Feris, for sharing his expertise and insights on trauma care and support. Let's also take a moment to reflect on the importance of prioritizing mental health and seeking help when needed. Remember, healing is possible and support is available. We would also like to take a moment to express our deepest gratitude to the first respondents. Your selfless dedication to saving others and providing care is the most critical moments, which is absolutely truly inspiring. From paramedics to our firefighters to our SAPS and emergency medical staff, your work is often unseen but never unappreciated. Thank you for your service, your compassion, and of course, your courage. Dr. Feris, how can listeners get in touch with you? And are there any final words for our listeners today?
Yeah, no, if anyone wanted to get in touch with me, You can reach us on our WhatsApp line, which is 072 And if anyone wants to reach out for education or any of these systems implementation, that's the number. My final sort of take-home message is trauma is a team sport. Getting the systems in place and getting the communication is critical, and that's what's going to save a life. Is working together as a community, as a healthcare system, and as a team. That's what makes a difference.
Absolutely. To our technicians, Delvin Peter-Marisburg and our Alansaar team, thank you for making the show possible. To our listeners, thank you for tuning in today's episode. Healthy choices, brighter futures, that's our motto here. And we believe that taking care of your health is one of the most important investments you can make. We spoke about buckling up, so it's a weekend. Make sure that you travel safely. And as Dr. Feris has mentioned, stay hydrated and have that mindful stops along the way. Jazakallah, assalamu alaikum. And until next Saturday, I look forward to connecting with you once again on The Pulse Show.